Howdy everybody, welcome back to MSK. My name is Jonathan and today we will be going over fractures of the clavicle. Let's hop into it. Alright, starting with etiology. How do we get clavicle fractures? Well, a very common way is direct trauma to the shoulder, the most common cause being a fall in which the patient would land on their shoulder. But it doesn't have to be from a fall. You can have a clavicle fracture from getting hit in football. I have personally witnessed someone get a clavicle fracture from playing Quidditch and getting hit, so stay safe out there. Additionally, we can also have indirect trauma to the shoulder in the case of falling on an outstretched hand. So if a patient falls and they reach out their hand, that force from the ground can reach through their arm and then reach the clavicle and cause a fracture that way. Additionally, the clavicle fracture can happen as a birth injury, which is the most common fracture during delivery. So if the baby is larger or there's a complicated delivery, let's say the baby's shoulder is caught behind the mother's pubic symphysis and we have shoulder dystocia, that's going to increase our chances of having a fracture or a brachial plexus injury leading to something like Klumpke or herb palsy. Alright, moving on to presentation. How will a patient appear? Well, the first thing a patient is probably going to tell you is that they are in pain. Now, on a physical exam, you may also see swelling, notice limited mobility, and you may hear crepitus with movement. So crepitus is sort of a crackling or grinding sound from the cartilage or the bones rubbing together. It's not a very nice noise, but that might also be indicative that the bone has fractured. Additionally, on physical exam, you may see or feel a palpable step-off where the bones of the clavicle are now misaligned because there's been a fracture and the two halves have moved away from one another. We may also see shoulder drop or a dragging down of the shoulder. So remember that the clavicle is what anchors the shoulder to the axial skeleton. So if there is a fracture here and it's no longer able to do that, the weight of the arm is going to pull down and drag this lateral side of the clavicle with it. And so you may see an uneven shoulder height on a patient with a clavicle fracture. There may also be a shortening of the clavicle, as we would see in this patient here with this x-ray. So because there are adductors of the arm, namely the pectoralis major, that's going to attach along here and want to pull the humerus inward, the clavicle helps to maintain that position of the shoulder. But with that fracture, that clavicle is broken, the arm and clavicle are going to pull in, and so we are going to see a shortening length of the overall clavicle compared to a healthy patient. We may also see tenting of the skin due to a protruding clavicle. So while the lateral aspect of the clavicle will be pulled down by the weight of the arm, the medial aspect of the clavicle will be pulled up by the strength of the neck muscles. This protrusion of the clavicle can cause the skin to tent over the site of injury. And lastly, it's always important to keep in mind that in the event of a fracture, there may be neurovascular damage to the nearby structures. So if the patient has a reduced radial pulse in the affected arm, or changes in sensation or motor deficit, further workup may be necessary. Alright, let's move on and talk diagnostics. So for imaging, the best initial test will be an X-ray in adults or ultrasound in children. Imaging will allow us to view the fracture and assess any displacement, as we see in this image, or dislocation. Generally, ultrasound is preferred in children in order to reduce the amount of lifelong radiation exposure they get. And lastly, we'll talk about management of clavicle fractures. So most clavicle fractures will be able to resolve with conservative treatment. So we'll use immobilization to make sure that the patient doesn't worsen an injury or displace the bones further. Because that patient will be coming in with pain, we need to address that, and so we will manage their pain with acetaminophen, NSAIDs, or even opioids on the day of their initial injury. And of course, we must consider surgical intervention in the case of a complicated fracture or with neurovascular compromise. Alright, let's do a recap and then we'll do a practice question together. Most commonly, the clavicle is fractured by trauma, either direct in the case of a fall or indirect, such as falling on an outstretched hand, or can be caused by a birth injury. Your patient will present with pain in the affected area, and there will be swelling, limited mobility, and you may hear the crunching of the bones together. The breaking of the clavicle may lead to palpable step-off, a shoulder drop, or a shortening of the clavicle, and even tenting of the skin, and there may be neurovascular compromise in the event of this fracture. We can view this injury with an X-ray in adult or ultrasound in children, and this fracture is very commonly found in children. We'll manage the fracture with immobilization and pain medication, and we will consider surgical intervention for very severe fractures. And a practice question might sound something like this. A 4-year-old male presents to your emergency department with complaints of right-sided shoulder pain. The patient's father reports that he was learning to ride his bicycle when he fell off and landed on his shoulder on the sidewalk. The patient has a heart rate of 104 beats per minute and other vital signs are within normal limits. The patient reports pain with movement of the affected side, and on physical exam, you note a palpable step-off in the middle of the clavicle. You suspect a clavicle fracture. What imaging test would you most likely order for this patient? In the case of suspecting a clavicle fracture, because we have pain, limited mobility, and that palpable step-off, for a child of our 4-year-old patient, we are going to order an ultrasound to visualize the fracture. Alright guys, that's everything for me today. Thanks for watching, good luck studying, and I'll see you next time.